Thank you, everyone. We're excited to start. So I think people are going to be rolling in, so I'm just going to go ahead and get started right now. But thank you all for joining. Let me share my screen and set up our PowerPoint. So we're really excited today. Maura and I are joined by special guests. We have Lizzie O'Hara, who's the Deputy Chief of Staff for the Ways and Means Committee for Democratic staff, and she is also a staffer for Congressman Richard Neal. We also have Rachel Dillon, who's professional staff for the Ways and Means Committee, the subcommittee on health. So we're really excited for them to join us today. They're going to be talking about the Build Back Better Act and sharing some updates and what was passed out of the House a couple weeks ago. And then we'll talk a bit about next steps in the US Senate and about our advocacy alert or an action alert for you all to reach out to Senators Warren and Markey. And then we'll do a quick update on the supplemental state budget. And then we'll talk about some of the ARC's state priority bills and then next steps on those bills. So without further ado, I'm going to have Lizzie just kick off what passed in the House and just talk about the provisions that focus on the disability community. So thank you, Lizzie, for joining us.
Sure. Well, thank you so much for having us today. We really appreciate it. And thanks for organizing this. I know that a lot of work went into organizing this on your end. And welcome to the folks that are joining us. If there's any question I don't have an answer to, I'm happy to speak with folks offline. I'm very accessible, as is my colleague, Rachel. So I'm Lizzie O'Hara, work for Congressman Neal in his personal office for Massachusetts issues, but also work with him at the Ways and Means Committee. And also joined by my wonderful colleague, Rachel Dolan, who is professional staff in our health subcommittee. And in fact, I'm gonna go very, very high level here and then turn it over to Rachel to speak on a couple things that are not in this presentation, but are really important. And she's super duper busy, so I want to make sure we get her at the beginning so that we can send her on her way. And she's also available for questions afterwards as well. So Chairman Neal played a large role, a substantial role, I would say, in helping to pass the Build Back Better Act in November, earlier this last month. And a number of the items in there are in the Ways and Means jurisdiction, and we're very proud of the work that the chairman did on those issues. And he worked closely with the speaker and Democratic leadership to ensure that it had passage in the House, and which happened on November 19th. And he is very supportive of this issue because he wants to support the work of the White House as well and ensure that President Biden can continue to do the work to bring our nation back from a very rocky 18 months. There are a number of issues in a number of provisions in the bill, and just go through them very quickly here. But one of the things I'll go over to Rachel now, there is a specific section in the health area and also the health area, I guess, and also in the human services issue area that Rachel can speak to. And Rachel, I will turn it over to you so you can highlight those important issues, and then I will jump off into the other items after you talk.
Great. Thanks so much, Lizzie. And just to echo what Lizzie said, really appreciate the opportunity to speak here today on these really important issues for people across the country and in Massachusetts with disabilities. So a couple of provisions I wanted to highlight for you all that were not necessarily on this slide deck were, and two areas that have been very important to Chairman Neal throughout this whole process, and actually for the last several years he's been fighting for, our provisions that provide and extend funding to the Elder Justice Act and to nursing homes across the country to complement all the important work on the home and community-based services side of things that have gone through the Energy and Commerce Committee in the House. So I'll start with the Elder Justice Act. And Mr. Neal has been a leader in this space, and I know that the name doesn't actually really justify all of the important programs that are under that. So, we like to emphasize that it's not just for people who are over the age of 60 or 65, but it also encompasses really important services for people with disabilities, including adult protective services. But a few years ago, Mr. Neal got involved in introducing a bill with the Senate with Chairman Wyden and Chairman Casey, and also Representative Bonamici, who leads the Elder Justice Coalition. And we have been pushing on these provisions to expand funding to the programs under the Elder Justice Act, which historically have been incredibly underfunded, as many of you probably know. And so we were able to get some money for the Elder Justice Act in the December omnibus last year, and then again through the American Rescue Plan. And then in Build Back Better, this represents just a truly unprecedented commitment to the Elder Justice Act programs, not only expanding funding to adult protective services, clarifying that it is for people under the age of 65, so people living in the community with disabilities, and also extending funding to the long-term care ombudsman training grant programs. But actually, through Build Back Better, we've also created 3 new programs this year and provided a significant amount of funding for several years. The first program would provide additional funding to the long-term care workforce. So regardless of setting, so this even includes a home and community-based service portion of the continuum of care for long-term care, providing funding to states to help support the workforce, encourage additional training of workforce members, and ensure that we're better able to retain people in this area of the workforce. I think COVID-19 really showed how important people are in the long-term care sector, providing these services, and how undervalued they have been throughout our nation's history. And so this puts a significant chunk of money into this space. Additionally, the Health Professions Opportunity Grant Program, this is outside of the health the Elder Justice Act, but with the Elder Justice Act Long-Term Care Workforce Program and the HPOG program, the House has committed almost $4 billion to this area of the healthcare workforce. So Chairman Neal's been really, really proud of that. It's also a health equity issue because as we all know, the folks working in this space tend to be women from communities of color. And so providing these resources, tuition support, childcare support, all the things that we know go into making a job valuable and making people stay in this field. That's really what this program is. The other 2 programs that are new under the Elder Justice Act, one of them addresses social isolation. So providing millions of dollars to community-based programs to address social isolation through AAAs or also other community-based organizations to help people in the community, seniors, also additionally anyone with disabilities living in the community on their own, to make sure that people are not continuing to suffer the unintended consequences associated with social isolation. The last piece of the Elder Justice Act that's new through Build Back Better is medical legal partnerships. So providing funding for these medical legal partnerships in the community that basically provide linkages between the health system, social service system, and legal system to help address some of the social determinants of health that we know plague people living in the community and living in facilities that need long-term care and other wraparound support services. So those are the key issues. The Elder Justice Act reauthorization that is in Build Back Better puts almost $4 billion into all of the programs that I mentioned. So really, really a huge commitment, and something that Chairman Neal has been championing for several years now. The other piece I wanted to mention on this call that wasn't highlighted in the issues that Lizzie's going to talk about was the nursing home provisions. We think this is important to go along and complement the home and community-based services provisions for people who are unable to stay at home or for whatever reason are unable to, or are prefer a facility-based setting for their care. There are important staffing provisions in the Build Back Better Act. And we know that low staffing rates in nursing homes are tied to low quality. They were also tied to much higher COVID outbreaks and COVID deaths. And so for the first time, this addresses that really real need in nursing home quality by creating a minimum staffing level in nursing homes, making sure there are registered nurses in facilities 24 hours a day. And then there are also a number of oversight provisions to help improve our understanding of kind of the level of quality being delivered in nursing homes to improve oversight. So, you know, we really think this is the nursing home facility-based side of the care continuum for people who need long-term care, who need post-acute care. And so it addresses the need to ensure that this whole continuum of care is being addressed, along with this really vital investment of $150 billion in home and community-based services that I said went through the Energy and Commerce Committee. So I think I'll stop there and turn it back over to you, Lizzie, to talk about some of the other non-health programs.
Sure. Rachel, thank you so much. I'm glad that you're able to join on this because those items have such a direct impact on the disability community, and seeing lots of head nodding, which is great because it's something that the chairman's very excited about. And also want to make sure Rachel gets her kudos. She's been working really, really hard on this. She has been a champion for the disability community by working on all these issues. So Rachel, thanks for taking time to walk folks through that.
Hey, Lizzie,
Rachel,
could I interrupt for 1 second?
Sure.
I wanted to ask Rachel before we move on, just kind of a very basic question, because all of the money going into workforce for long-term care and the programs that will help support it. I mean, the obvious question is, will that money be increasing rates of pay across the board? Do you see it doing that? Because as much as we say we need a fully staffed nursing home for quality, like when the pay rate isn't high enough, we're just not going to get those people in. So is that part of the plan to like federally push the increase?
So, I mean, I think that is obviously the long-term goal among Democrats. You know, in my capacity working on Medicare issues for Chairman Neal, that's not in my purview in terms of the programs that I oversee, but Chairman Neal has been championing this workforce and trying to push on this issue. As you know, a minimum wage was not something we were able to include in the reconciliation, like a minimum wage increase across the board was not something that we were able to include in the reconciliation package because of the weird rules around that. But, you know, Democrats have been championing this for a long time. I think this was a way to infuse money into the system as a starting point right now, right? These are immediate changes. And so we're hoping that if we increase the standards, we infuse money into the state to provide some wraparound supports for this workforce, there will continue to be a push in this area to really to get at this minimum wage, which, you know, obviously the Education and Labor Committee, would oversee a lot of that work.
Thank you so much. I think Sue has a question.
Thank you so much. This is such amazing timing, and kudos to everyone for such hard work. I'm with UMass Medical School, and I run a training program for pre-healthcare professionals interested in serving individuals with developmental disabilities. And one of the things that we're trying to do in terms of just supporting Senator Moulton's efforts in terms of the Heads Up Act, and the idea that higher reimbursement rates would, at least for physicians, be available if we are successful in having a federal designation of medically underserved for individuals with developmental disabilities. I guess the broader question is there any, do you know if there is any possible connection between what might be insured in terms of higher reimbursement rates for PCPs that are serving individuals with developmental disabilities, and then by proxy for any direct care staff that would also be providing support to this population?
So are you talking about specifically in the long-term care settings or just across the board for PCPs that are handling this population?
I would say more specifically the facilities, the long-term care.
So unrelated to Build Back Better, there has been this significant push to basically through the Medicare physician fee schedule
Right.
to sort of reallocate money in a way that really reemphasizes the need for primary care payments. So this is something that actually went into the physician fee schedule rule, a big change to how E&M payments occur across the board. This happened last year and is something that we've been working on for a very long time in the federal government. And so that was a huge thing. And so basically in the pot of the physician fee schedule, there has been a re-emphasis on paying more for primary care. Now, it's not specific to addressing the needs of people with developmental disabilities. It's an across the board thing, a recognition that the physician fee schedule needs to re-emphasize primary care. And that's something that the Centers for Medicare and Medicaid Services has done through the regulatory rulemaking cycle. So it's outside of the sphere of Build Back Better. I would say the provisions that I mentioned here are meant to address kind of the lower level workforce. So, you know, the need to pay more for CNAs and provide wraparound supports and LPNs. Now, we did have a very important provision also in Build Back Better, which I didn't mention, which is our Pipeline to Practice program, which is investing in people coming from underserved communities, you know, first generation graduates who are interested in going into medicine. And it is really a huge equity provision, right? We look at the physician workforce, and essentially there are very few people coming from communities of color, from immigrant communities. And so this is actually putting a ton of money into the system to kind of change the nature of the workforce. It's the Pipeline to Practice program. It did go through the Ways and Means Committee. And so this is something that Chairman Neal has been advocating through our racial equity initiative. Mr. Horford, Ms. Sewell, Mr. Gomez have all been pushing for changes to the physician workforce. And so this is a huge deal and something that we're all pretty excited about.
This is huge. You made my day. So thank you. We'll I'll be following up with you, and Maura, you must be thrilled with this as well.
Yeah,
thank
this
you.
is fantastic.
And I'll just say I have a couple other brilliant colleagues who have spent more time working on that than I have, because I've been doing the long-term care stuff. So if you want to email me, I'm happy to connect you.
I will. Thank you so much.
Great.
Thanks for taking my question.
Of course.
So anyone else have questions for Rachel before we move on? If not, Rachel, thank you so much for joining us at the top of this. Really appreciate it. And if anything else comes up, we'll let you know.
Yeah,
thanks,
happy.
Rachel.
You guys have my email, so feel free to reach out. Take care, all.
Thanks,
Thanks,
Rachel.
Bye-bye. Okay, so Ellen, do you want me to continue on with the other items? Okay.
Sorry, I was muted. Yes, that'd be great. Thanks.
Okay. So there's a whole bunch of stuff in here, and we can go over this fairly quickly. The home and community-based services, that's really exciting. That's mostly in the energy and commerce space, but as Rachel said, a lot of that was complemented by the work that the Ways and Means Committee did as well. So go to the next slide. Education and childcare. This is something that the Ed and Labor Committee did a lot of work on. Tons of money for preschool, IDEA Part D things, and the childcare issue, and then the state items. That's terrific. So we were all very supportive of all this with our colleagues over the Ed and Labor Committee. You can go to the next slide. Housing. This is something that, of course, as we saw during COVID, pulled the curtain back on how much housing had an impact on public health perspective of COVID. You know, families that lived in multiple family homes, folks that would come home from work and bring COVID home with them. And unfortunately, people that had lost their jobs couldn't afford their rent. There are just so many different angles that this impacted. So there's substantial funding in housing, and we are very pleased and supportive of that. Here are two big things Chairman Neal worked really hard on, very, very supportive. Paid leave, the 4 weeks. He was pushing for much longer than that, but was pleased that we were able to get some paid leave language in there. He worked very, very tirelessly on this issue. And we're hoping that the Senate will see the great things that we did on this issue and support it as well. The child tax credit, that has had a huge impact already on a number of families, and it truly is going to have a generational positive impact on poverty in our nation. And this is something that we want to shout that from the mountaintops about what a huge impact the child tax credit has had and will have going forward. So those are two huge priorities that Chairman Neal was a champion on. And these two items went through the Ways and Means Committee and passed with the House as well.
So did I.
Next. EITC, extending the Earned Income Tax Credit. Again, huge issue for Chairman Neal. He was so proud that this passed through the Ways and Means Committee. And also extending SSI to the residents of Puerto Rico and other U.S. territories was a huge issue as well. As you know, there's a number of Puerto Rican communities in Massachusetts and particularly in Western Massachusetts. So delighted that this was impacted in a good way. And I believe someone had some SSI reform questions, which we can get to that once I go through all this. But this is something that he was very proud of as well. Healthcare. As you know, a number of states did not expand Medicaid. And so I was trying to identify ways that we could expand benefits to folks that are in states that did not have that expansion. We're so lucky in Massachusetts to have such wonderful coverage. And these two items are something that Chairman Neal worked really hard on. And he is all about, as you know, protecting the Affordable Care Act, expanding the Affordable Care Act. And so we were very, very happy about the expansion of eligibility and also expanding benefits to the Medicaid program. And that's something he will continue to champion. Okay, what other items do we have here? Yes, Chairman Neal always is talking about the importance of apprenticeship programs, and particularly in the disability community. So these are items that he supports strongly. All these items, let's see, funding for projects. Yes, these are all these items are things that Chairman Neal supports and will continue to protect going forward. Next slide.
For the slides, we have a link to the ARC of US's Action Alert to reach out to
terrific.
senators. So I was wondering if you have any thoughts on the next steps. I mean, it's obviously in the Senate's court right now.
Right.
Are there concerns about some of the provisions that passed in the House that will get left out
Yes.
in the version? And what do you recommend that we as advocates should be doing
Right.
to encourage the Senate to keep these disability provisions in?
First of all, thank you so much for bringing attention to this, because it's really important that folks know what's in the House bill and what fantastic things are in there, and that passed the House. And now Build Back Better Act is as we say, with the deliberative body, and they are deliberating. And we are hoping that they deliberate with items that the House supported. Unfortunately, it's my understanding, based on discussions that I've been hearing about, that some items may drop out or be watered down significantly, which would be just all the work that we put into it on the House side and all the good it will do for so many communities, and particularly the disability community. I think it's really important to stress to folks that the Senate needs to pass as much of the House language as possible, just because of the positive impact it's going to have on so many communities and so many families, short-term and long-term. So I think making sure that we're lucky in the Senate, I mean, in Massachusetts with our senators, but we always say, like, you've got your cousin in Arizona or your roommate from West Virginia, things like that. Just ensuring that that the Senate passes as much of the House language as possible, I think, is really important.
To circle back
Mm-hmm.
to the SSI question, so
Yes.
we've been asking for some significant improvements to SSI, and
Mm-hmm.
we just discussed with your office before, and I was curious, we were hoping some of that would make it into the Build Back Better Act, and we obviously are very excited that it's being expanded in Puerto Rico and other territories, but I just want to make sure, I'm asking if that's going to be taken up again in the future, if Representative Neal is considering looking at improving SSI.
Right. I mean, he's always open to, hold on a second, I'm going to go off video for 2 seconds because I'm about to sneeze.
It's fine.
Okay, it went away. So, so this is something that, he's always willing to look at proposals to improve FSI. So if you could resend your thoughts on that, that would be really helpful. So I can talk to the chairman and also my colleagues in the Social Security Subcommittee and the Worker and Family Support Subcommittees, so that making sure that they know that you want to continue looking at ways to improve SSI.
Okay, and if anyone else wants to chime in on that, if there's any, or if there are any other questions for Lizzie.
And with regard to vehicles or opportunities for that, I don't know.
Right.
Just because it's been kind of a wacky couple of weeks, and the end of the year with Congress, as I always say, it's an obstacle and an opportunity. So you just don't know.
I just wanted to clarify,
go ahead.
Ellen, are you talking about the Ssi Restoration Act? Is that what you're referring to?
I am, yes.
Okay, that's what I thought. Okay, just wanted to clarify that.
Right. Thank you, Jesse. And would it, if it was something that the Senate had put in, if they put in the provisions from the Ssi Restoration Act, would that be something that could be considered again? Like, let's say it goes into the Build Back Better Act in the Senate version.
Right. So if something goes in, if the Senate, with reconciliation rules, it gets tricky on what they can and can't do. And then whatever changes they make will likely have to come back to the House.
Right.
So it's hard to say what could or would happen.
Okay. All right. Well, thank you so much. We'll follow up with you.
Yeah, please do. And I'm happy to go in the weeds
Yeah.
on that. I just, it's just hard to say yay or nay on things at this stage.
Yeah, and I imagine it's going to be difficult. No,
So, but yeah, send me your thoughts on that, and be happy to flag that for my colleagues.
Okay. Thank you.
Any other questions?
Questions for Lizzie? I think she's likely going to jump off, and we'll provide some state updates.
And if not, I'm always available. This is not the end of a discussion, but the beginning of one. I'm always willing to chat with folks. So feel free to reach out to me offline.
Thank you. And thank you so much to Congressman Neal for championing this bill. This is incredible. We hope this stays in the Senate, and just thank you for all you've done for the disability community. We really appreciate you. Thank you for joining us today, and Rachel as well.
You got it. Have a great day, everybody. Thank you so much.
You too, Lizzie.
Thanks, Lizzie.
Thanks for the work you're doing.
Thank you.
Take care.
All right.
All right. So this is the action alert. We just want to make sure that we're, keeping up the drumbeat in the Senate and encouraging, just so they're constantly hearing that these provisions matter. that affect our community and that they don't get lost in the Senate. And so thank you. And thank you all that have already done, so many action alerts before. We wanted to give you a quick update on the state budget. We're excited to say that that last night the House and the Senate agreed on a compromise spending bill. So this is a supplemental budget, and it has almost $4 billion from the American Rescue Plan Act that was passed in Congress, or U.S. Congress, last March. So we've been pushing this for a long time to see that the funding be fully released, and that's going to have a huge impact on our workforce. So there's $300 million in this that's going to strengthen, enhance, expand the HCBS workforce, as well as a rate increase to about $16.79 an hour to the direct support professionals. So this is really, really important stuff. It's a little tricky that we're now in the informal session. So it's as far as the vote that goes on in the House and the Senate, which we expect that they're going to take up the bill today. At least that was the news we got. Maura had shared late last night from State House News. And but one member could derail it with the roll call vote. So we're hoping that that's not the case. And I think that that leadership is confident that this is going to move forward and pass both the House, and then likely the Senate will follow suit tomorrow. So it's great news, and thank you for all your advocacy on this, and we appreciate you reaching out to your legislators and making sure that that this gets passed, and quickly. We knew it would likely pass, but it's taken a long time for it to happen. So we're encouraged that they're willing to do this in the informal sessions. So,
yeah, Ellen, I want to apologize for anybody that sent out a letter from my link last night, because I posted it. And then about an hour later, I saw the news come up on State House News. So I deleted my post just because we really don't want to confuse, the reps and senators who, are like, wait a minute, I thought we did this. Because we wrote a very strong letter, and it was definitely really trying to push them into making sure this passed before the recess. Providers are really struggling, and families are really struggling with the fact that safety is at risk right now, and wait lists are growing by the day. And so this is super important for them to do. And I think it was, we were hearing from our contacts, like Ellen said, that it was going to go through, but sometimes we have to take that extra push. But yes, we'll keep you informed, and even if it's late night.
right. Yeah, and just to be clear, we had prepared the action alert, but we did the ARC. We sent a letter to leadership yesterday early afternoon. So we did get something out directly to them, but yeah, we did have a whole plan with an action alert going on. But that's no longer needed, which is good news. So does anybody have any questions on that? Okay, and now, Maura, do you want to cover our priority bills? What's next?
Yeah, sure. So I just wanted to start with thanking everyone. Some of you guys are, well, I think most of you guys on here have been very active with our legislative priorities in submitting written testimony, and even showing up at the hearings and testifying and signing up and doing that long waits. So really a big thank you, because it makes a huge, huge difference. And I just wanted to make sure to clarify that, these hearings that have been going on since the summer and are continuing, we have another two more hearings to go before the end of session that have our priority bills included in them. These are all 100% public hearings, so anybody can sign up and testify. The ARC, often notifies people through our notes and social media that a hearing is coming, but we do have over 20 priority bills, so we don't always have a chance to get out, oh, here's a coming hearing. We're just kind of scrambling to get our testimony ready, And so we appreciate anyone that can jump in, and anyone that wants fact sheets or additional information, we're here to give that out. I just don't want people to think in any way we control who testifies. Anybody can testify. And often we do testify with coalitions who have been working on a bill with us for years. So there's a couple of bills right now that we've been working on: the Disability Commission bill, the supported decision-making bill. Many of our other bills have been working with multiple groups. So you may see the ARC's panels include people from those coalitions who've been doing the work with us. So I just wanted to clarify that. And we do have a couple of important dates coming up, and that's why we wanted to once again review the bills with everyone, because as soon as the recess happens and people are on sort of that holiday break, Christmas time break, everything happens really fast in January. The new budget comes out, and then suddenly we're at Joint Rule 10 in February. And that's when, if your bill hasn't come out of committee, you're not gonna have a chance to push that through for this session. So all of these bills that we have in front of you need to come out of committee prior to February 9th or 10th, I think, which is Joint Rule 10, maybe it's 10th. So if any of these bills that are listed here are ones that are really important to you, now is a very, very important time to follow up with your legislator. And if you did not testify or provide written testimony, I would say go ahead and write some testimony. Whether or not that testimony ends up going to that the committee can utilize it at this point, or you can submit it to the next committee, like Ways and Means, where our advocacy has to intensify even more. So looking at these bills, we really hope to see, more than a half a dozen of these pass through. We usually have a pretty good record getting our priority bills through the first committees, which are Children and Families and Public Health and Public Safety, and sometimes Judiciary. So we're hoping to see many, if not all, of these bills come out of committee. But then the really intensive work happens, because Ways and Means, or maybe Healthcare Finance, is kind of, sucked with a ton of bills. And somehow we have to get ours to rise up and prioritize. So that's when you start seeing from us action alerts for the bills, where we're saying, jump on board, write to your legislator, tell them to go to Ways and Means and push this bill to the top. So expect to see some of that coming, but in the meantime, these bills are not out of their first committee yet. So we need you to contact your legislators to say, this bill's important to me, can you contact the chairs? If you haven't submitted testimony and you want to submit it, you can submit it directly to the ARC, and we can get it to the committee staff. So does all of that sound familiar and make sense from years past? And are there any bills on here right now that anyone on the call has questions about? Yeah. So
I only to note that I'd love to talk to you maybe offline a little bit more about the Joint Committee on Public Health, the two bills that are there, just for obvious reasons in terms of training. So this is so exciting. Thank you.
No, you're welcome. And we had some good news from around hospital training. Definitely some interest there in pushing it through, but we don't get like a full confirmation. We just have a lot of good vibes about a lot of these bills.
Thank you.
So anything else on these? Do we have anything else in the chat?
Yes, I just wanted to clarify that banning abusive therapy, is that the aversives bill?
It is. Yeah, it's banning aversive therapy, not abusive, but that's okay.
Yeah, I think I pulled it from.
No problem. Yeah.
So,
No,
so what happened? I know what happened with that. How's that going?
it was a pretty intense hearing. I don't know. Yeah, you missed. That's right, Jassy, because I was going to ask you to testify there. Yeah, so it was a long hearing. I thought there was going to be over 100 people testifying. That was my estimate, but it ended up being about 65 people, I think, testified, which is still a very long day for the committee. And to be honest, as every session that we support this bill, the opposition to this bill comes on pretty strong. So they had a lot of questions from the committee on both sides. And I would say it's definitely you know, a bill that comes with a lot of controversy, and it takes a lot of consideration from the committee. But because we have new chairs and a lot of fresh faces on the committee, that we feel like there's definitely a chance that the bill will come out this year.
Were you able to ever connect with the woman I put you in contact with, Karen Weigel, I think her name is?
Well, we connected, you know, just a little too late for her to testify orally, but she can definitely still come on and do some written testimony. The committee's accepting testimony, you know, definitely through January. So yeah, it's a tough bill. It really is. It was pretty amazing to hear the families speak about the need for the JRC to continue. And so the legislators have a lot to think about. But we're also trying to collect some more data and work with some of the providers here in Massachusetts who see the most complex cases, and to really put together some more compelling facts to present to the committee.
I guess there's a book that recently was published called Stop the Shock, written by a New Hampshire author. That might be an interesting reference to use.
Yeah, and that Stop the Shock campaign has done just an incredible job getting, you know, thousands, I don't know, almost 2,000 signatures, I think. And, you know, it's been a great grassroots effort.
Thanks.
So we're continuing to meet with committees to do follow up on these bills. And so if anyone has, you know, any questions in the coming weeks, just be in touch with me. Ellen, is that it? Sorry, I couldn't remember if there was another slide.
Just so if we have a small group, I figure we can just get on the PowerPoint.
Yeah, that's great.
Yeah, I think that's everything, unless anybody has any questions or want to talk about something. I mean, I'll say, I don't know if any of you were on our Turning 22 calls that we had recently. There will be some follow up on that. We want to let you know that we really appreciate many of you, or the people that had joined. We had a lot. We had, I think the first call we had over 100. So obviously there's a lot of conversation